progress.
Good morning. Welcome, everyone. Welcome to today's webinar in our Ask an Expert series. Today, we're focusing on employee mental health and wellness. Just a quick housekeeping item. Please be advised that we are recording this session. So I do want to let you know that any questions you ask in the chat function will also be recorded. My name is Dave Hyde. I'm the manager of the Small Business Centre of Barrie, Simcoe County in Orillia, and I will be your moderator for this morning's session. The Planning Committee and the Ask an Expert series is led by the County of Simcoe. Over the last 2 years, we've been able to bring organizations throughout the county some excellent content as you navigate the current environment. I encourage you to keep an eye out for future webinars. We have a lot of great content coming your way soon. I'd like to take a moment to thank our presenting partners, our regional partners who assist with bringing these webinars to life. So alongside the County of Simcoe is my organization, the Small Business Centre of Barrie, Simcoe County and Orillia, South Georgian Bay Small Business Enterprise Centre, Orillia Area CDC, Nottawasaga Futures, North Simcoe County Futures Development Corporation, North Simcoe Community Futures Development Corporation, Community Futures, South Georgian Bay, Sandbox Centre, and the Georgian College. So you can see that it is a truly collaborative event that really covers the whole range of the county. So prior to today, several of you had shared questions with us. These were provided to our guest experts, and many of the responses have been incorporated into their presentations. However, we're also hoping to have an opportunity for questions at the end of the session. If you do have a question during the presentation, do just add it into the chat function. You're probably all familiar by now. We've been at this for a couple of years, but the chat function is at the bottom of the screen. And we'll obviously try to address as many questions as we can at the end of the presentation. So once again, my name is Dave Hyde, and it's my great pleasure to facilitate today's session. And I'd like to just take a moment to introduce our two speakers. So first of all, we have Liz Grummett, who is part of the fundraising and communication team at CMHA Simcoe County branch. Liz has been part of CMHA Simcoe County for over 20 years, working across a variety of settings, including case management, crisis intervention, outreach support, education, and fundraising. Liz enjoys connecting with her community in both a professional capacity and through a variety of volunteer roles. Liz recognizes the value and importance of maintaining an open mind and having an empathetic approach when connecting with others. Also joining us today, I'm very happy to welcome Sandy Kriegish. Sandy joined Homewood Health in August of 2008 as a clinical manager and senior account executive. She has a master's degree in educational psychology, a bachelor's degree in communication, and over 30 years of experience in the field. She is an experienced trainer and does consultations with managers and senior leaders regarding conflict, communication, managing change and stress, team building, harassment, workplace violence, coaching skills for managers, performance and behavioral issues, and many other topics. So Sandy, Liz, wonderful again to have you with us today. We appreciate you sharing your expertise with our audience this morning. Without further ado, Liz, I'll hand over to you to give us our first presentation, please.
Perfect. Thanks so much. All righty. Okay. And can everybody see my screen all right?
We can indeed, yes. Perfect.
Okay, wonderful. So thank you so much. It's always a privilege to spend time with folks in our community. We know conversations about mental health are truly important, and I'm just really grateful to be here today. So just a friendly little start that, what we're going to share today, is just meant for educational purposes. Nothing that I'm going to share is intended as a substitute for medical advice or diagnosis or treatment. I'm not doing any type of counseling during this presentation. I would encourage you, though, as Dave had shared, if you want to connect with me, my information will be available. So please, if there is some further support that I can offer, I would love to connect. Okay, so we'll get started. So whenever I do a presentation, I like to remind people that, if you have a brain, then you have mental health. And I'm not sure what people think about when they hear mental health. So maybe, think to yourself, what words come to mind when you first hear those words, mental health? Is it perhaps depression? Do you think about psychiatry? Do you think disability? Or is it that you think about mental illness? So many people use both those terms like interchangeably. So, you use mental health and then mental illness, but we do know that they mean very different things. So first of all, mental illnesses are a disturbance in our thoughts, our feelings, our perceptions, and they're severe enough to, really affect our day-to-day functioning. And, we can think of some of those examples, schizophrenia, anxiety disorders, major mood disorders. And then when we think about mental health, it's more of a state of well-being, and we all have it. So like I said, if you have a brain, which I know we all do, we have mental health. So just like, we focus on our physical health, we also have to really look after our mental health. And it's not about just surviving, it's about thriving. It's about enjoying life and having a sense of purpose and being able to manage, life's highs and lows. And I think certainly after the last 2 years, everyone has experienced, probably some challenges in our mental health. We know that 1 in 5 people in Canada will experience a mental health problem or illness in any given year. But we know it's 5 in 5 of us that have mental health. So just a good reminder about, sometimes people think, oh, it's those people that struggle, but it's everybody that can struggle. It doesn't discriminate in any way. And then thinking about the workplace. So sometimes what happens in our workplace that a coworker or a supervisor may not even be aware that there's a mental health situation happening. And we know this is a product of stigma. So stigma is that negative stereotype. And that's what really stops people from getting help. And we are working really hard, to fight that stigma. And we know it's changing. We see more people reaching out for help. When we speak to youth and kids in schools, there's more of a conversation happening. Kids are not afraid to speak up and say, I know what anxiety is. I've heard about depression. So we know it's changing. We just need to do more work on the other end around treatment opportunities and options for people to get help. But that's another conversation about funding and government. So in your workplace, what can you do to maybe, address stigma and make it easier for folks to talk to you about what they're struggling with? So being aware of your own behaviors, your own attitudes. We all judge, judgment is part of being human, but, paying attention to what your judgments are, and are they affecting how you're possibly communicating, the importance of mental health in your workplace. Think about your words. We know language is important. We know that there are words that are very hurtful around mental health and mental illness and addiction. Think about the language that you're using. Think about the language that maybe some of your coworkers are using. Is there an opportunity to have some education about how we talk about mental health? And we're going to do some more education a little bit about how you can have that conversation. But we do know that stigma prevents people from seeking treatment in the workplace. We know that only 36% of employees would actually discuss a mental health concern with their manager. So you probably are thinking, what can I do about that? And again, it's having a conversation, which we're going to share. Because sometimes what happens is it might be a really minor issue. And if it doesn't get shared at the beginning, some early accommodation that probably could have helped gets missed. And then things can get worse. And then, we know that mental health affects so many things in our lives, but we want to remember that wellness, that well-being in our workplace is a big part of our leadership. So proper leadership practices can really help make employees more comfortable in disclosing their mental health related difficulties. And that's about having a workplace culture that's built on trust, built on honesty and fairness. I would encourage you to think about your workplaces, and is it an environment that is conducive to good mental health and allowing staff to feel comfortable about sharing their concerns with management? So I have some stats here. We know that 1 in 5 Canadians will experience a mental health problem each year. So that means, if it's not ourselves that's struggling, it's somebody that we certainly know. It's a coworker, somebody that we care about. We know that 1 in 3 will experience a mental, the first was a mental problem each year. This one is a mental health concern in their lifetime. And we know that every week, 500,000 Canadians will miss work due to a mental health concern. So again, I'm so thankful that everyone's here today to learn about what can you do in your workplace, because this is an issue that we really need to address. And again, it's not being afraid to ask questions and not being afraid to have those conversations. We know that there's, 30% of disability claims are related to mental health, and the number that I saw recently was $51 billion are lost annually due to mental illness in the Canadian economy. So you're probably asking, so what can I really do? How do I start that conversation in my workplace? So again, I'm not here to try to train everyone to be a psychiatrist or a psychologist. It's about just starting the conversation. It's not about having all the answers and being an expert on mental health. It's about how you listen. And listening is an important skill that everybody can work on. And when you're sitting down with somebody you work with, whether you're as in a supervisor role or as a coworker, you're listening to try to understand what is the perspective of the person that you are meeting with. So how do we listen? How do we show somebody that we want to provide support, we care about them, we want to help? Some really simple things. Think about your body language. How do you know if somebody's listening to you? How do you know? What are some tips? Is their body language open? Are they making eye contact? Are they relaxed? Have they put their phone away? I feel like that's something I say a lot to my teenagers. Put your phone away so you can listen to me. They say things. Are you facing the person? Are you showing that you're here and you're not distracted? Are you able to carve out some time to truly show that you want to listen and you want to have a conversation? And like I said, we don't have to have all the answers. Sometimes just saying, hey, can we talk? I really want to hear what's happening can be the biggest help. Asking questions, sure, we can ask questions, but one question might be, how can I help you? What do you need? Really simple. When you're having this conversation, it's not about having a list of questions that you're going to drill through. It's taking time. And I know it's busy. I know we all work and we have huge demands, but it's really important. If you want to have that culture in your workplace, it's important to take that time and show that you're interested and you really want to help. So allowing somebody to talk, and this can be tough, right? If you're maybe in a management role or you're in a leadership role, you might be used to maybe you're the one that's always in control and directing. So it might be difficult for you to take a step back and pause and allow that person to share. There could be silence. Sometimes a person may need, time to process and really think about what they want to share with you. So allowing some time, being patient, try not to think that you have to solve problems, but just allowing somebody to share with you what they're feeling and what's happening for them. As a listener, you can think about, what is the person sharing? Are they sharing things that are important to them? Are they talking about their values? What possibly, can you pull from the conversation by listening? So as I was saying, pausing, again, allowing silence, having that time carved out, really important things, okay? So something else about staying engaged is, thinking about what the person is sharing and are there certain beliefs, are there endeavors they're looking for, and not interrupting. So listening, processing it yourself, letting them talk. Big tips. Sometimes we interrupt. I'm a little bit of an interrupter myself. I'm working on it. It's a daily thing. I think I'm a helper, so I want to fix things. So if somebody shares, I need help with A, B, and C, I instantly I have a solution. And that's not helpful. Sometimes I can really shut down the conversation. And, if anything you take away today, it's about allowing somebody to talk in your workplace, allowing somebody to share, and not stopping that conversation. Asking questions about clarification. Hey, I'm hearing this, and is this what you mean? I'm confused. I want to make sure I understand. That's okay. That shows that you're listening, and it shows that perhaps you are really understanding where they're coming from. All right, here's a big one, stress. which I know that everybody is experiencing, especially after the last couple of years. So think about right now, where do you feel stress? How does stress feel in your life? So we know stress affects our entire body. It affects the body. First, it affects the entire body. So let's think about the body. Your muscles, your head, your neck, your stomach. Perhaps your breathing is increased. Maybe your heart races, right? Maybe you don't sleep very well. Maybe you sleep too much. Maybe you're just really tired. Perhaps you see changes in your actions. Maybe you're using other substances, alcohol, drugs. Maybe you're using those substances to help you cope. Maybe you find yourself withdrawing from people, drinking more coffee, losing patience. That one's a big one for me. When I start to notice my patient level has really changed, I have to do a good check-in. Fidgeting. And then there's changes in the way our emotions are happening. Perhaps you feel more worried. Maybe you're more confused, angry, irritable. That feeling that you just can't cope. And then lastly, thinking about how you think. Are you having trouble concentrating, remembering, making decisions? Are your thoughts racing? How is your self-confidence? Has it changed? Do you have an overall negative attitude? So this is a really important, again, piece to really check in on yourself, check in on your coworkers. Are you seeing a change in the people that you work with? And that's going to tell you a lot. And that's what we really want to focus on. How do we, manage our stress, and how do we keep ourselves well? So again, 2 years of living in a pandemic, and we are all definitely feeling the effects. Perhaps you're struggling with burnout, loneliness, and depression. So thinking about our stress level, paying attention to how we're feeling, and then again, thinking about how do we take care of ourselves. And self-care, we hear a lot about self-care, especially in social media. There's a zillion things out there, candles and oils and baths and spas. But it doesn't always have to be that. It doesn't always have to be very complicated. But we need to know that it's important. It's not an indulgence. It's not something that you can put on the back burner for another day. It's something that we really have to manage so that our stress keeps us more productive, our stress is lowered, and that we're more productive and we're having that really great work-life balance. We know balancing our life is really difficult. We're working, parenting, some of us are caregiving, and during the pandemic, it's become more stressful, exhausting than ever before. So just taking a few minutes can really help, how you're managing your stress, which helps you maybe be able to do more and continue to doing all those chores. I want to remind everyone that we've been in survival mode for a long time. If this is something that you're really struggling with, how you're managing stress, you're not alone, right? We're all, everybody is struggling. And that can be a really important thing to tell yourself too, that you're not alone, and to validate. It makes sense that we are feeling this way because we've been living through a crisis situation for 2 years. So it makes sense that we're more overwhelmed than we ever have before. So when we think about self-care, it's especially important now because we're struggling so much more. And again, it's about self-preservation. It's a necessity. It's not just an indulgence. And I did see there were some questions about some, smaller things we could do for self-care. So not great big tasks. And we're going to talk a little bit about some ideas. But again, we have lower energy, so we want to keep things as simple as possible. Burnout is something we're seeing more and more. And when we think about burnout, it means the depletion of our physical and our emotional resources. And that can lead to actually an increased, feeling of worry, a dissatisfaction. And then you start beginning to really dread daily activities. So again, monitoring how you're feeling, monitoring, are things becoming so unbearable that you need to actually seek treatment, greater than just self-care. So perhaps you need to reach out, and we're going to talk at the end about some resources. So I hope this shares a little bit about, paying attention to yourself and really checking in about, what is happening and how you're feeling. Burnout, is a huge conversation. Some things that we want to remember is if you are struggling and you're having a hard time in your workplace, try to refocus and check in on your values. So taking a moment to really think about, your personal and your professional values. This can really help you reduce those feelings of inefficiency that leads to that emotional exhaustion and again could lead to burnout. So, if you're struggling in your job, um, try to think about what started you in this profession, right? Think about, what were examples of how you positively impacted the lives of whether it's your clients or your customers, your patients, or your community. What started you in this work field? Can that maybe help you kind of bring back to refocusing about, what is important to you and what are your values? We know in the healthcare field, it's really difficult right now. Demands are high, and perhaps if you work in that field, you're surrounded by illness and injury, pain, and hurt, and that impact, can really, really bring you down. So again, trying to bring yourself back to why did you choose to work in the healthcare, and maybe that will help with some of that daily tasks. And again, try to bring your focus back to what are your values and what's important to you. So self-care, what can we do? So some quick, things to think about. And the first one is around social media. I'm guilty. I spend a lot of time on social media. I can feel the drain. I know I need to take breaks because it just affects everything, the way I think and the way I feel. Hearing about that pandemic over and over and over is not helpful. Listening to news that's negative, the war, there's so much happening. You really have to check in about how much time you're spending taking breaks. Being on a screen, so I'm surrounded by screens at my job. I'm not sure if that's something in your own work, taking breaks from the screen, doing something else. Taking care of our body. We hear this all the time. Getting a bit of exercise. How are you eating? What are you eating? Are you sleeping? Do you need to take a break? Do you need to move around more? There's lots of great opportunities out there around meditation and about breathing exercises. So thinking about, do you need to make those type of changes? Balance. So again, we're working probably harder than we ever have worked. Again, so looking at how is your life balance? Is work too much of your time? Are you able to maybe take a break? Look at what other areas need some focus. Connecting with others. So again, during the pandemic, this was something that really was hard. We of course had lots of virtual options, but now, the clouds are hopefully are opening up a bit, and think about how you connect with others, with people who maybe have the same values and beliefs as you, so that they can actually provide support for you and you can support them. Accepting support. That's another big piece. We say reach out, talk to somebody, but be willing to take that support and own it and let it help you from others. Routine, we've heard a lot about keeping a routine, even though you might just walk downstairs and turn on your computer in your house to work, keeping a routine, getting up, getting dressed, brushing your teeth, making your bed, having breakfast. When we have a routine and we follow that routine, it tells our brain that things are okay, which can really help decrease some of that anxiety that we're experiencing. And then the last thing is, again, thinking about what can you control? We can only control ourselves. We can't control anybody else in this world. We can't make people wear masks if that's important to you. We can't make people be vaccinated if that's important to you. We can't make people do anything. We can control ourselves. We can control how we take care of ourselves. We can control what we do to keep well, and that's it. We can't control our teenagers or our staff. We can provide opportunities, but we can only look after ourselves. So that's the biggest piece about my presentation today, is taking care of yourself and really, protecting our mental health. And then I'm just going to finish up with some resources. There are piles. Of course, I encourage you to visit cmhastartalking.ca. We have a massive page that's been divided into all different kinds of categories. Lots and lots of resources. If I can say one thing out of the pandemic is that there is so many resources now being offered virtually and free. So that's great. Bounce Back is an amazing program that got increased funding over the last couple of years. It's a free program for 15 years of age and over that helps manage, moods that could be mild to moderate depression, anxiety, stress. It's delivered over the phone, but you're working with a coach. There's videos that you can watch. They share tips and tools. And again, an amazing program. So Bounce Back, check that out. We have a crisis line that is available 24 hours a day, 7 days a week, filled with amazing staff who know the resources, who know how to help, who how to listen. You know, nothing is stupid to call about. Anybody can call and talk. Amazing. Something that's new that I just found out is about for frontline workers. Waypoint is offering a pretty amazing support system as well. I don't know where my time is, so I might be actually getting a little bit over time. Anyways, lots of great resources. CMHA National also offers so many packages around workplace health, workplace wellness that you can use and then, of course, utilize in your places of work. So I'm going to end it there. And I am again so thankful that people joined us today, and I hope that this was helpful.
It certainly was, Liz. Thank you very, very much. A lot of, really thought-provoking points there. I wrote down a ton of notes, but what particularly resonated with me was when you spoke about leaders and managers, how we have a tendency to jump in and try to fix a problem,
Right.
And it's so important to remember just to take a step back, listen, and really try to truly understand the problem before you jump in with your toolkit, as it were. So thank you for that.
Perfect.
Appreciate it. So wonderful. Thank you, Liz. And Sandy, over to you now. We'd love to see your presentation.
Thank you so much. Looking forward to lots of questions as well. So I will try to, are we good? Can you see my screen?
Yes, we can see it. Yeah, thank you.
Okay, fantastic. So I know Liz, great presentation. She mentioned employee assistance programs at the end, and that's actually what Homewood Health is, among many other things. But I'm part of the employee assistance program side of Homewood Health, and so I put together just a few slides based on what we're hearing, what we need to sort of share with people nowadays. I also just wanted to give people a sense of, what are the latest numbers? So this is just a very recent survey done in partnership with CBC and Angus Reid Institute. I don't want you to pay attention to all of these numbers, but look at the very last line, your mental health. So would you say things are better, worse, or unchanged since March of 2020? And people said, 54% of them said their mental health is worse than in March 2020. Probably not surprising to many of you. However, as we know, there have been so many ups and downs and so many changes. Women are faring significantly worse. 60% of 18 to 34 said their mental health had worsened, and 63% of women 35 to 54. I also just want, and I don't have a slide for this, but I also want to say that the research is also showing that younger people are faring worse as well. Children, teenagers, people in their 20s, and really up until 30, but younger generations are showing many more signs of struggling with mental health issues than ever before. And so you may also be seeing that in your workplace. How do you distinguish between what's normal and what's not? And we hear that question all the time. You can have presentation jitters, like I do before every presentation, or do you actually have an anxiety disorder? Should I worry about this? What are the blues versus major depression? And so just want to give you a sense with this chart. So really what we look at as psychologists and clinicians is these indicators on the left: frequency, duration, pervasiveness, intensity, and then the biggest is impact on daily functioning. So if someone is struggling, it's normal to struggle for short term, occasionally in one or two situations. Maybe you're afraid of flying and you've been able to get away with not flying all of your life. And so it's that one situation where you just avoid it and it hasn't been a big deal for you. Impact on daily functioning is what we as psychologists really look at probably the most. What is happening in your relationships, in your work, is your mental health struggle being impacted, or is it impacting your daily functioning. And so if it is getting in the way of you being able to do or be what you want, that's when we start to cross the line into it's probably something that you could use some help with. So I want to just talk about scientifically what works for mental health. We know that counseling works for mental health. We know that cognitive behavioral health counseling really helps for mental health. It's kind of the gold standard. We know that social support matters hugely. When I was in private practice, I would say that 90% of people who came to me had very few social supports. They did not feel that they had strong relationships with people, and that really matters. Self-care, as Liz talked about, is really huge. It can fall apart easily, and we need to create those habits or rekindle those habits. Stress reduction and mindfulness. People are often looking for that magic pill, if you will. And I can tell you right now that the research shows that mindfulness meditation for short periods of time throughout the day, if you create a habit of a mindfulness meditation, it can change your life and it can improve your mental health dramatically. So the number one issue that we're seeing in the pandemic is anxiety. Being able to spend even 5 minutes in a mindfulness meditation is really key to bringing down anxiety. And the research shows, I mean, the reason why people are adding these things to their work day, you know, you look at Google and they did it probably 20 years ago where, you know, they had a company sponsored meditation, and that kind of thing is working. It's been working, it continues to work. So if there's one thing that you're thinking about adding to your company in terms of supports, I would think about that. And then of course, we know that medication does help a lot of people and may be necessary for people who are dealing with maybe more severe depression, anxiety, or other mental illnesses. I also just want to point out, this is a great quote. This is from decades ago. Having a sense of control, remember? Sense of control, perception over one's work is a key component of mental health and psychological well-being, even more than being overwhelmed by the volume of work. So people will complain about being overwhelmed by the volume of work. But if you can give them a sense of control over some of those things that are happening, some of the decisions that are impacting that work, and if you can add choices to people's work and give them a sense of you know, influence and impact and control, it really matters in terms of psychological well-being. I would be remiss if I didn't talk about how change affects us as human beings. Here's the deal. There's no change that we go through as human beings that doesn't create a process, a psychological process for us. You can think about all the changes that have been happening over the last couple of years. And I mean, my gosh, we could probably fill a few walls just coming up with lists of those changes for people. And it's different for everyone. So what we have to know, and this is key, every change that is instituted at your organization, every change that's happening within our broader community and world, people have to go through transition. And so, you know, for example, this, think about, you know, the return to work. Some of you may have, you know, brought people back to work. When we stopped going to work, that was a huge change, and people liked it, didn't like it, you know, but we go through these emotions. So at first, you should expect with every change that there will be some negative emotions: denial, anger, fear, anxiety, panic, stress, and depression. And if we are given a chance to transition in a healthy way to that process, we will get to the positive emotions of acceptance, adjustment, and even growth. I think probably most of you would agree that we've grown as human beings, whether we want to or not, over these last few years. And sometimes we need to be dragged through this kicking and screaming. But, the reality is, it's a process that everyone goes through. So, and when you're instituting a change at your organization, you have to think about that you've already gone through this transition knowing the change is coming. When you're first telling your employees about that change, they're starting fresh in this process. And so don't be surprised by negative emotions. When you're bringing people back into the office, or you're changing the way that they've been working over the last couple of years, people finally got used to something and maybe they got to the adjustment phase. And then we're doing it all over again. So expect that people are going to take time to adjust to every change, and that you will hear some belly aching and some negative emotions out of that. Managing any team, of course, comes with some challenges, and you might not know how, if people are struggling with a mental health issue unless they tell you. I did want to just bring this up, since anxiety is, again, the #1 issue that we are dealing with really globally. That people who have anxiety in the workplace may have problems. They find these situations difficult. Even setting and meeting deadlines might be difficult for someone who's anxious because they have a fear of failure, or they're afraid that their anxiety is going to get in the way. Managing staff, participating in meetings, making presentations, and then for some, business travel. For some people who had anxiety, not traveling, not going outside, not, having to get out in the world was great for their anxiety. But now, as people have to start doing these things again, you may find people even, I've talked with many people who end up leaving a job because they fear their anxiety is going to get in the way, or they suddenly need to travel and they don't want to do that. So there are lots of things you may be seeing in the workplace. I just wanted to bring up this, important piece of how anxiety might be showing up. How do you respond and when to respond? Those are key, I know. If anyone self-reports any kind of symptoms or mental health issue, or huge stressors, that's time to respond. Any change in work quality, any coworkers saying, wow, I'm really worried about him or her, behavior, change in appearance, those are different. Of course, observe changes in behavior, more emotions, less emotions, more anger, all of those things. Of course, odor of alcohol and drugs, or evidence of impairment, late arrivals or absences are what we tend to look for as well. And then any employee who's returned to work and appears to be struggling. All of these things shouldn't be a shock to you, because I'm hoping that many of you have instituted, especially throughout this period, regular check-ins where it's not just about the work, but like Liz said, are you asking how they're doing? I read a stat the other day that 40% of people said that no one has asked if they're doing okay throughout this difficult time. When people are going through a difficult time, they want people to ask, are you doing okay? Is there anything as your manager that I can do to make things better? Is there any resource that you need from me? The employee's role, and sometimes we get, this is one of the things I find in my consultations with managers that people struggle with more than anything, is breaking down that line between, well, what are we responsible for as the employer, and what's the employee responsible for? It is the employee's responsibility to be ready for work and to be able to perform. If they can't do that, you can provide them with, time, resources, all the support that you possibly can. But we also need to make sure that we're not taking the responsibility of that on us. It's not your responsibility to make sure that an employee is ready or able to perform. It's your responsibility to point them in the right direction and encourage them to use as many resources as they can to get there. All right, so I don't want to read all of this. I just, obviously, as leaders, we need to make sure that if you haven't, as a company, made psychological health and safety one goal of yours for the next year, it's time. It's past time. You should have a plan for how are you going to help mental wellness of your employees. And of course, understand and help leaders know how they would refer employees for further support. Make sure they know what your organization and what your community offers to support people who are struggling. Don't assume you know the cause of the changes in work performance. Don't make a diagnosis or act as a counselor. I find a lot of people who are managers might, cross that line sometimes. Don't be afraid to be direct. One of the things about even suicidal people is that we're afraid to ask the question, are you saying that you're going to harm yourself? That is a really essential question when people are kind of beating around the bush or giving you some indirect signs that they're really struggling. Things to avoid, I do find, especially, and I'm gonna stereotype here, but it's just a stereotype. Men especially are maybe a little less comfortable having that one-on-one mental health conversation in the workplace. If someone comes to them and says they're struggling, they might be the first to say something like, I'm so sorry you're going through this, but it'll get better. Don't worry about it. That we need to not do things like that. We need to instead, have a plan. And if you don't know how to handle it, get some help from HR, get some help from your EAP, get some help. So I love that Liz spent time on self-care, because if you're not putting your own mask on first, you're going to be in trouble. And so stop and do that first before you can, before you do what you can for employees. I want to go ahead and get people asking questions, because I know that there were so many wonderful ones, and hopefully we'll be able to add some more information and resources through those.
Thank you, Sandy. Appreciate that very, very much. And yes, folks, please, I do see some questions coming in, so we'll give a second for that to populate. I just wanted to sort of say, it was interesting to me over the course of the pandemic that I think a lot of the discussion just in society was, I can't wait to get back out and see people again. And yet, as I think you really covered really well, Sandy, I think by the time we actually got to the point where people were coming back to work, there was, I noticed certainly a great deal of social anxiety about what that actually meant and how to behave around someone. And are we shaking hands here, or are we, I'd still like to wear my mask, or just, in some cases maybe lost even some of that conversational skill, that we used to when we're sort of in person. So that really resonated with me. And I do see some questions coming in here, so I'll just pop one up here if I may. So great question here, actually. Should we be treating counseling like we do an annual physical at the doctor? Would this help us to protect our mental health? So maybe Liz, you want to take that one first, and then I'll flip to Sandy there.
Absolutely. And it was interesting. I heard somebody in my workplace the other day say, oh my gosh, all these, younger staff, they all have therapists and they check in all the time. And that's just so amazing. And it was a person who was, more my generation, thinking, I never did that. And it's just becoming, something that we do. You go to the dentist, you get your physical, you have a therapist, you have a counselor, and you do that check-in. So again, going back to stigma and how, it's really changing, how important we now know, and we're talking more freely about our mental health. So yes, good idea.
Mm-hmm.
Yeah, let me just add briefly that I've always been a proponent of this. I think that, obviously we don't all go to the doctor when we need to. People wait until their mental health is in crisis. And when we do that, and then we struggle to find timely and the right help out there, that's a problem. So if we can do more mental health awareness about, what are the symptoms of some of these things inside the workplace, allow people a chance to know before it becomes a crisis.
Mm-hmm. Great. We've spoken a lot about obviously mental health perhaps that is being affected by workplace scenarios, but how would you approach, say, a staff member that has maybe the cause of their mental health challenges are outside of work? You know, they're having financial issues or issues with family, that sort of thing, and it's affecting, you know, you can see it and it's clearly affecting their work, but it's really nothing to do with the business. Do you have any thoughts on how one might approach that from a management point of view?
Do you want me to go? Okay. So I think, again, having those conversations are truly important, right? Asking those questions so you can find out that information, because, you know, that would be an amazing thing to know if my staff was struggling. If I knew that information, like how wonderful that could be, so that we could find the resources for them. And I think, you know, Sandy did a great job talking about the EAP programs. Those programs have access to specialists in all those areas, right? Like I know through ours, you can talk to somebody about, you know, your kids going to school and financial planning, you know, divorce, those type of things. So really pulling in on some of those resources that you might have in-house already. And then again, there's so many other resources. So I think, again, you don't have to solve those problems, right? We're not experts on every single issue in this world, but maybe finding some resources for them. And again, keeping that conversation open, checking in, just like Sandy said, you know, checking in is so important.
Yeah, absolutely. You know, again, it's, you know, those are all issues that we, many of us deal with throughout our lifetime. It's really just being a supportive person as a manager and saying, you know what, I'm sorry that you're going through, you know, this extra stress, and it's got to be really difficult. And if there's anything that I can do here at work to support you, let me know. You know, and of course, you know, like Liz said, try to find some resources along with them, but don't take it on yourself. Again, you know, this is not your role to try to solve that problem for them.
Indeed, yeah, and you know, and I can speak from personal experience, having used the family assistance program that we're fortunate enough to have here with the city, and you know, all three other members of my family have used that program. So if you have you know, access to a resource like that, I would thoroughly recommend it. I think it was yourself, Liz, that referred to some of those kind of, you know, techniques that we can use, those quick techniques. But I'm interested, we have a question here about offering meaningful support to employees. They offer yoga sessions, working from home twice a week. They have mental health first aiders on hand. But if you were to maybe give an idea in terms of what you think is, maybe this is an unfair question that I'm posing here, in terms of what would be your top one or two things that would make a real difference to people that approach you as a manager in terms of, you know, their mental health struggles.
Yeah. When I saw that question, I thought, well, that's amazing. What an incredible workplace that's already doing so much. The mental health first aid is a great program, and certainly if you visit CMHA National, you can find all the links to access that type of support. So amazing. Kudos to you already for doing a great job. I think flexibility is a big piece. Is there a way, you know, so maybe, you know, we're really famous for having surveys. What do people really want? You know, asking those questions. What would be helpful? What would be helpful? You might get some ideas. Flexibility, as I just said, I think is really important, especially when so many of us are working from home. Are there ways to incorporate, you know, something with your daily routine, with how you're managing your workload? Are there some ideas that you can maybe change? But again, ask your staff, what would be helpful, right? Like that was the question we keep saying, what would be helpful? What are you missing? What could we do better?
Mm-hmm. No, that makes perfect sense. Sandy, anything to add there?
Liz covered it beautifully. Yeah, absolutely. I think asking, I mean, we can come up with as many ideas as possible. I think, you know, company-sponsored meditation is a great one. It's helped a lot of companies. Empathy training for leaders is really key. I would add maybe that, if, you know, because your manager and feeling supported by your manager is really, really key. But other than that, you know, I think doing a survey is always a great idea.
Mm-hmm. Great. Question here in the chat that actually sort of echoes a question that was sent in previously, and I think, Sandy, you covered this in one of your slides, so I'd be interested to hear your thoughts in terms of How do we, we have a company that's very very aware of mental health issues, and that sometimes, they can affect us all, but they struggle with folks calling in with mental health issues. And I guess what we're essentially saying here is, how do we differentiate between a mental health issue and, I hesitate to use this word, but perhaps an excuse? So can you give any thoughts on that, please, Sandy?
Absolutely. Yeah. People take mental health days for many, many reasons. And I get that, it's hard to know where that line is. But it's really no different from physical health. If someone is, if their performance is being impacted, and because they're not there doing their job, or they're unable to perform the job up to the level that you need them, then that's a performance issue. And so taking mental health days is so helpful. I would hesitate, I know people will often say that people use them as excuses. And I think this reminds me of, like, people will often say that teenagers are lazy. Laziness and excuses to me don't really exist. I think that if they're taking that time, there's a reason for that. And we may not be able to know, or quite, maybe they don't truly have a diagnosable disorder, but they have a reason why they don't want to go to work. And so you got to have those conversations. You got to sit down and say, hey, you know what? I've noticed that you've called in you've called in these mental health days 4 out of the last 16 days. Is there something going on that I can help with? How can I, what's going on from a work perspective that we can help with? But, basically saying, I notice, reflect what you're seeing, and how can we help? Because we need you to be here. We need that person to, to do what they're supposed to do. These conversations are never easy. And if you do have an employee assistance program, I highly recommend that you call for a consultation, because each situation is different. But there's always a reason for behavior. And I think that we need to try to not necessarily get to the bottom of it, but encourage that employee to figure out what's going on as well.
Mm-hmm. Very interesting. Liz, would you have any thoughts on that?
No, that was wonderful. I think, similar to what Sandy was saying, it's an opportunity, right? And again, when we think about, I loved your example, lazy, or, what would you say, lazy, and it's an excuse. Again, that kind of feeds into that stigma, right? Oh, mental illness, it's not serious. Only weak people struggle. So again, check in with yourself. Is there a judgment there that's affecting how you are supporting your staff? Are you maybe you have something that you need to kind of reflect on as well? Because again, mental health, physical health, it's all the same, and we have to really take care of it. So consider it as an opportunity. Have a conversation. Hey, I notice. I love that. I notice. Really important.
Fantastic. Thank you. We do have a question here in the Q&A, and it relates to mindful meditation. Sandy, you spoke about this, and I believe you did too, Liz. So the person asking the question says they find the word meditation has a bad connotation. Now, what kind of things meet this idea but don't necessarily bring up a sort of a negative, dated stereotype? So when you talk about mindful meditation, could you maybe give a quick example of that sort of thing, what it is that you mean by that?
Yeah, so you're right. Even when I first heard about meditation, I was like, I don't know, not for me. And I find that the more that people are exposed to what it is and all the different ways, sitting and staring at a wall for 5 minutes is meditation. It really, our minds are constantly going. And the reason why anxiety is such a huge issue for us right now is because we don't know how to slow down our minds. It leads us to memory problems, organizational issues, all kinds of things. And so when that happens, the way that we used to slow down our mind, maybe in the old days, is we would have space and time in between activities, or we would have margin, or we would go out in nature, or we would, do things. These are all forms of meditation. Music is meditation. There are some wonderful apps out there. There are companies who are dedicated to coming on site to your company and creating, bringing their mobile meditation studios or creating meditation in your space. I know that for some people it might, some people may never get into the meditation, but there are two things. Yeah, walking. Someone just said that. I love that. Walking meditation. Walking is meditation. You're thinking, but you're also giving your mind time to come down from that. And we're retraining our mind to focus. And that's really, I just want to, one really quick thing that I often use when I'm talking about this is the 5-2-1. I'm sorry, 5-3-1. 5 minutes of meditation a day. 3 things that you write down. Is writing down things actually, is a psychological process that helps. 3 things that you felt were good about your day. I know a lot of people do gratitude, that didn't work for me, but if I can think about 3 things that went well throughout the day, I can do that. And then 1 random act of kindness. If you can do those 3 things throughout a day, you will start to feel better in no time. 5 minutes of meditation, 3 things you write down that went well about your day, and 1 random act of kindness.
5-3-1 rule. I love that.
Yeah.
That's great. Thanks, Sandy. Liz, any thoughts on that?
That's wonderful. And I remember when mindfulness was first introduced, I was like, oh my God, like I can't slow my mind down. Like, I can't do this. And we had the opportunity, we went to classes and I would just sit there, and I'm definitely that kind of squirrel, like, oh, look at that, right? So it was hard to lay on the floor and spend 20 minutes, right, trying to control like where my thinking was. So I use a lot of just bringing my attention back to my breath. Breath is always with you. It's something you can do anywhere. You can do it quickly. Like, even if you just spend 30 seconds, how is my breathing right now? Like, so my breathing right now is a little bit rushed. I'm nervous. What can I do? I'm not going to change it. So I'm not saying slow down your breath, take deep breaths. No, just pay attention. Just pay attention. Pay attention. And again, mindfulness is about being in the moment. So being in the moment could be like you're going for a walk. I like to watch my dogs. My dogs, I have 2, and they play. And I love watching them play. And again, that's mindfulness. I spend, 5 minutes watching them. I'm focused. I'm not on my phone. I'm not thinking about work. And that's all it is bringing your attention to something for just a few moments. And that can really help, just like Sandy was sharing, how we're feeling completely overall.
Mm-hmm. Wonderful. And Sandy, Liz, I feel like we could keep talking. The questions are coming in, and there's so much great information that you guys have shared. Unfortunately, we're almost at time here, so it just remains for me to say to everyone, really, thank you for attending today's session. A survey will be sent out by email along with a recording of the session after this event. So please let us let us know via the survey what you thought of today's session. If there are other topics you'd like us to cover, we really would love to hear that. If you're interested in hearing from more of our experts, information about this series can be found at simco.ca/ask an expert. Thank you again, Liz and Sandy, for your time and insight and expertise today. That was amazing. And thank you again to all of the partners involved in making these sessions a success. I wish everybody a fantastic remainder of the day and remainder of the week. It's blue skies outside, and the temperature, I'm reliably informed, is going up at some point. It has to be. But anyway, Liz, Sandy, and to Johanna at the county, thank you very, very much for a wonderful session. Really appreciate it. Stay safe and enjoy the rest of your day.
Perfect. Thanks so much.
Thanks. Bye-bye now.